I completed a single subject design comparing the effectiveness of eCOIC plus man training versus man training alone and increasing one-word mans in neurotypical toddlers. My rationale for choosing this training was because manding is very crucial and important. It allows us to express our wants and needs, and when an individual is unable to do that in a functional way, they often engage in behaviors or they experience more distress because they're unable to communicate what they want and need. And research shows that focusing on teaching more than one verbal operant at a time is the most beneficial. However, I did notice that there is a lack in research. This research was done in 1992, and I could not find any recent research done on verbal operants, comparing the effectiveness of them when it comes to basic mans and whether or not we should be teaching them all together or if it's just as effective to teach one at a time. So that's my rationale for choosing why I did this research. And the participant in my study is a 2-year-old neurotypical little girl. She does not have any developmental delays or diagnoses. However, her parents still did say that there is a communication barrier and she'll often not have the words to express what she wants. And so she'll point to items, and when asked, is this the right item? And they're trying to give her what she wants, she'll say no repeatedly, and they can't figure out what it is that she is pointing to or what it is she wants. So I saw a need there to kind of help give her some man training and ecoic training so that she can express herself better and get her needs met, and then kind of ease the parents too, so they're not so overwhelmed trying to figure out what it is that she needs. So like I mentioned earlier, I did a single subject design. I did more specifically an ABAC design. The independent variables were manned and ecoic training, with dependent variable being the frequency of independent one-word vocal mans. And then frequency data was collected by tracking how many independent mans Noel engaged in per hour. So then during the baseline, the initial baseline, I just simply observed her in her natural environment without doing any preference assessments, without any prompting or teaching, just recorded how many mans she was engaging in for each session. So that's that first initial baseline. During the first intervention phase, I completed a preference assessment and modified the environment to create more manding opportunities. And when I would see that she was motivated for an item, then I would use full verbal prompting to prompt her to appropriately mand for the item. And then upon emitting the vocal one-word mand, I immediately would reinforce her with the item that she manded for. So there was a lot of environment modification in this intervention. So just removing toys out of reach a little bit so that she wasn't able to reach them and she had to ask for me to get them, things like that. And then after that intervention, it went back to the baseline. So just repeating that same initial phase. And then during the intervention 2, I did the same man training procedure, but I also included ecoic training. So I probed her ecoics using the early ecoic skills assessment, and I chose 10 different ecoic targets to work on from that. So throughout each hour, we worked on each sound like 2 or 3 times, and I would provide positive reinforcement immediately upon her emitting either the correct sound or just a vocal approximation in order to encourage her to talk and tell her that she's doing a great job. Even if she doesn't say it correctly, she's still attempting to and getting closer to each sound and each word. So I made sure to provide a lot of positive social reinforcement. And then for the results, we could see that in intervention 2, when echoic training was included in the intervention, her independent man's went up pretty drastically. Because in intervention one, the highest it was 53 mans per hour. And then intervention two, she was able to increase that all the way up to 89 independent one-word mans per hour. So that was really cool to see that while man training is effective, using other verbal operant trainings combined with it, such as echoic trainings, makes it even more effective, and that the kids can learn how to, in this case, speak or make requests even faster with using both interventions. So while both interventions improved man frequency, the combination of echoic and man training in the second phase resulted in a much higher level of independent one-word mans. And then one thing I wish I could have done differently is include a variety of just more participants. So not only do it with this one participant who doesn't have any diagnoses, but maybe do it with a few more kiddos who have developmental delays or who have been diagnosed with autism to see how they respond to the interventions, if it's going to be the same results. Um, if the results would be any different, if maybe the progress would be slower, but it would still be noticeable just to see what that would look like. So I think that would improve the validity of the research. Um, and then I also think teaching multiple verbal operants simultaneously was effective. And I think that in the future, we could also include tact training and see if combining all three would be even more effective, or if that would be too much for some kiddos. So I think it just kind of, it might depend a lot on the demographic. And so I think future research could look at that some more.